So here we are, July the 13th. Yesterday I was sick, so I was not able to come on live video to stream about therapeutic approaches. So I'm doing it tonight, July 13th. So the previous night, it was all about building a supportive network. So please watch and listen to that video, Healthy Living. So why are therapeutic approaches? What are they exactly? So therapeutic approaches refer to various methods and techniques used by healthcare professionals to aid in the treatment and support of individuals seeking mental, emotional, or physical healing. These approaches are tailored to meet the needs of each individual and also aim to promote personal growth, improve your well-being, and address specific concerns or any issues that you may have. So therapeutic approaches can be used in a variety of settings, including individual therapy. I did that. Group therapy, I also did that. Family therapy, I also did that years ago. Or a combination with other forms of treatment. Some common therapeutic approaches include cognitive behavioral therapy, psychodynamic therapy, person-centered therapy, family systems therapy, and art therapy, among many others. Each approach has its own theories, principles, and specific techniques that therapists utilize based on their training and as well based on the needs of their clients. So what are specific methods and techniques for people with mental health who want to heal emotionally and mentally? I went through it, so I can tell you it's really tough. It's really hard. It's very emotional. It's like a roller coaster of emotional trauma. So there are numerous methods and techniques that can help you seeking to heal emotionally and mentally. I'm going to give you a few approaches. The number one, cognitive behavioral therapy, CBT. So this focuses on identifying and changing negative thought patterns and behaviors that contribute to emotional distress. It helps you develop healthier, more positive ways of thinking and responding to challenges. So techniques in CBT include cognitive restructuring, behavioral activation, and problem-solving skills. Number two approach, mindfulness-based therapies. So mindfulness-based approaches such as mindfulness-based stress reduction, MBSR, and mindfulness-based cognitive therapy, MBCT, they help you cultivate non-judgmental awareness of your thoughts, your emotions, and present moment experiences. These techniques can promote self-compassion, and don't we all need we need more of that, right? Reduce stress. Oh yes, we need to reduce stress. And also it helps enhance emotional well-being. Number three approach, psychodynamic therapy. So this therapy explores the unconscious processes and past experiences that influence current emotions and behaviors. So this approach aims to increase your self-awareness and also your understanding of underlying, often unresolved conflicts. Therapists may use techniques like free association, dream analysis, or interpretation of transference and counter-transference. Number four, acceptance and commitment therapy, ACT. ACT helps individuals accept their thoughts and emotions rather than trying to avoid or control them. It also focuses on clarifying personal values and taking committed action toward living a meaningful life. Techniques in ACT include mindfulness exercises, values clarification, and cognitive diffusion. Number five approach would be dialectical behavior therapy, DBT. So it's often used to treat individuals with borderline personality disorder and those who struggle with emotional regulation. So it combines elements of CBT with concepts of acceptance and validation. So skills, training in emotion regulation, distress tolerance, interpersonal effectiveness, and mindfulness are central to DBT, also known as dialectical behavior therapy. The sixth approach would be creative therapies, so such as art therapy, music therapy, or dance movement therapy. They all utilize artistic expression and creativity, so you can explore your emotions, you can reduce stress, and also promote self-discovery. So these therapies, these techniques can be especially beneficial for individuals who may struggle with verbal communication. So if you have autism, if you are an autistic person, this is the perfect therapy style that can help you. Creative therapies. Number 7, supportive counseling. Supportive counseling provides a safe and non-judgmental space for any individual to discuss their concerns and also to receive empathy and validation. So this approach focuses on listening, offering emotional support, and providing guidance during difficult times. So it's also, of course, my sister and my brother, it's important to note that the approach method or technique may vary depending on your specific needs. So it's advisable to always consult with a mental health professional who can assess your situation and provide personalized recommendations. So therapy is best pursued under the guidance of a licensed therapist or counselor. So there you have it. So tonight's episode, it's all about therapeutic approaches, a deep dive into evidence-based therapies such as cognitive behavioral therapy, CBD, that I just mentioned, dialectical behavior therapy, DBT, that I also mentioned, and mindfulness-based intervention, explaining their effectiveness in treating depression and anxiety. So what is the best therapy method for someone suffering from depression? Well, the choice of therapy method for someone suffering from depression depends on various factors, including the individual's preferences, the severity of the depression, and their specific needs, and also their circumstances. So, however, several therapy methods have proven effective for treating depression. So here are some commonly recommended approaches. The one that I mentioned earlier, cognitive behavioral therapy. This one is considered one of the most effective treatments for depression because it focuses on identifying and changing your negative thought patterns and behaviors that contribute to depressive symptoms. So this approach helps individuals develop more positive and adaptive ways of thinking, as well as learning strategies to manage negative emotions. Number 2, interpersonal therapy, IPT. So this one focuses on improving relationships and interpersonal functioning, as difficulties in relationships are known to be a common contributing factor to depression. It also helps individuals identify and address interpersonal problems, improve their communication skills, and also build a support network. And talking about support network, listen to episode 4, which is building a supportive network in this channel, in this podcast. I did this on July 11th, building a supportive network. So, number 3, how to combat depression, behavioral activation therapy, BAT. So this one is specific form of therapy based on the notion that engaging in pleasurable and also rewarding activities can alleviate depressive symptoms. It can help, with your depression. It can make it less stressful and less overwhelming to deal with. So this involves identifying and scheduling activities that will bring enjoyment, and a sense of accomplishment, helping you restore motivation, and also it will improve your mood. Number 4, it's mindfulness-based cognitive therapy, MBCT. So it combines elements of CBT with mindfulness practices. Remember what I said earlier, CBT is cognitive behavioral therapy. So it helps individuals identify their negative thought patterns and develop skills to change their relationship with these thoughts, ultimately reducing depressive relapse and also promoting well-being. Number 5, acceptance and commitment therapy, ACT. So this one aims to help individuals accept their thoughts and emotion while taking steps toward living a meaningful life. And we all need to live a meaningful life, a joyful life, a life where we feel accepted, where we feel appreciated, and where we feel loved. So this one focuses on developing psychological flexibility and also values-based action rather than attempting to eliminate or to control depressive symptoms. Number 6, which is one I don't really adhere to, is medication. So while therapy is a primary treatment for depression, there are times where it's really necessary. So medication can help you, especially for people with moderate to severe depression. Antidepressant medications prescribed by a psychiatrist or your primary care physician, that can be used in conjunction with therapy to alleviate your symptoms. So it would be next to therapy, but you have to be really careful and make sure to read the ingredients and know exactly what's in those antidepressants, because some of them are really not good and they are definitely not recommended at all. So that's why I stay away from any pills and any medication. Even for my own children, years ago when I went to the therapist and they wanted my sons to be under medication, I said absolutely no way. I do not give my consent, no. So it's important to consult with a mental health professional, of course, who can assess your specific situation and will tailor the treatment approach to your specific needs. And the best therapy method may vary, from person to person, and some individuals may even benefit from a combination of all those different techniques that I just mentioned. Now, what about an individual who is suffering from anxiety and panic attacks? I was suffering from panic attacks, anxiety, and the depression, of course, after I left and while I was with my ex, the covert narcissist. So what are the best techniques to heal and to live a healthier life free from these mental health issues without using medication? There are several techniques and strategies that can help individuals suffering from anxiety and panic attacks manage their symptoms and improve their overall well-being. While medication can be helpful in some cases, many people prefer to explore non-medication approaches, and I'm one of them. So here are some effective techniques. Earlier I mentioned cognitive behavioral therapy, the CBT. So this one is widely recommended therapy for anxiety and panic disorder. Like I said earlier, it will focus on identifying and challenging your negative thought patterns and beliefs that contribute to your anxiety. And a lot of individuals learn coping skills to manage anxiety symptoms, such as relaxation techniques, cognitive restructuring, and exposure therapy. Number 2, deep breathing and relaxation techniques. So deep breathing exercises such as the diaphragmatic breathing or the 4-7-8 breathing technique can help calm the body's stress response, and it will promote relaxation. Of course, progressive muscle relaxation, guided imagery, and meditation are also effective relaxation techniques. Number 3, which I mentioned earlier, mindfulness-based stress reduction, MBSR. This one utilizes mindfulness practices such as meditation, body scanning, to bring awareness to the present moment and also to reduce your anxiety. and it helps you cultivate non-judgmental awareness of your thoughts and your emotions, allowing you to respond more effectively to anxiety triggers. Number 4, exposure therapy. That one involves gradually and systematically exposing you to feared situations or triggers in a safe, of course, always be safe, and controlled manner. So this will allow you to reduce your anxiety response through repeated exposure and learn that your feared outcomes may not actually occur. So this one is exposure therapy. Number 5, acceptance and commitment therapy, ACT. So this one helps you accept your anxiety rather than trying to eliminate or suppress it. And it also focuses on identifying your personal values and taking committed action towards those values, even in the presence of anxiety. So these ACT techniques include mindfulness, cognitive diffusion, and values clarification. Number 6, lifestyle and self-care. So engaging in regular exercise. I always mention that, how you have to stay active and keep it moving. Your body is a machine, but you need to keep moving it. So maintaining a balanced diet, of course. I spoke about this in my previous podcast episodes. And getting enough sleep, plenty sleep, and also reducing caffeine, alcohol consumption. All these lifestyle and self-care approaches will help you support your mental well-being and also minimize anxiety. Engaging in activity that brings joy, of course, and have your brain relax. Hobbies that you enjoy doing, that you enjoy participating in, and also nature, the beauty of having a backyard or trees or a park near your house. This is a blessing, so use that. Spend time in nature. That's very important. Number 7, support networks. Yes. So on the episode on July 11, I spoke about building a supportive network. So support networks, building a support network of trusted friends, family members, or support groups, anyone that you trust that can help you, that will provide a sense of understanding, validation, and also encouragement. So sharing experiences with others who have similar struggles can be particularly beneficial in reducing feelings of isolation and of anxiety. It works. I did it. I'm a living proof. You need to make sure you find the right people that can support you. So it's important to remember that every individual is unique, and what works for one person may not work for another. A mental health professional can assess your specific situation and provide personalized recommendations. These techniques can be even more effective with the guidance of a psychotherapist that is trained in anxiety and panic disorder treatment. Yeah, I'm very sorry. That was my 21-year-old daughter calling my 16-year-old son. But I had to stop her by clapping. That's what we do also when someone calling us or talking to us while we are praying and they're not aware that we are praying. While they're walking toward us, if we are in a different room, we clap so they will understand that we are praying, not to be disturbed. So there you have it. Now, regarding some mental health professionals who have written books on depression and anxiety, as well as PTSD, who can you recommend? Someone wrote that. Who can you recommend? Someone asked, who can you recommend reading? So there are numerous mental health professionals who have written books on depression, anxiety, and PTSD. So I'm going to share some well-regarded authors in these areas. So in depression, I have 4. I think I can name. Yeah, I can name 4 different authors in depression and anxiety, and also in PTSD. So the first 4 for depression Feeling Good, A New Mood Therapy by David D. Burns. The Noonday Demon, An Atlas of Depression by Andrew Solomon. Lost Connections, Uncovering the Real Causes of Depression by Joanne Hari. And The Upward Spiral, Using Neuroscience to Reverse the Course of Depression, One Small Change at a Time by Alex Kolb. So these are the 4 authors that wrote books on depression. Now, books on anxiety. The Anxiety and Phobia Workbook by Edmund J. Bourne, The Anxiety and Phobia Workbook. My Age of Anxiety, Fear, Hope, Dread, and the Search for Peace of Mind by Scott Stossel. Dare, The New Way to End Anxiety and Stop Panic Attacks by Barry McDonough. And Anxiety, The Missing Stage of Grief, A Revolutionary Approach to Understanding and Healing the Impact of Loss by Claire Bidwell Smith. So there you have it for depression and anxiety. Now, for PTSD, I also have, 4 authors. The Body Keeps the Score, Brain, Mind, and Body in the Healing of Trauma by Bessel van der Kolk. Man's Search for Meaning by Viktor E. Frankl. Complex PTSD, From Surviving to Thriving by Pete Walker. And the 4th book, Trauma and Recovery, The Aftermath of Violence, From Domestic Abuse to Political Terror by Judith Herman. I highly recommend that one. Trauma and Recovery, The Aftermath of Violence, From Domestic Abuse to Political Terror by Judith Herman. So these authors provide valuable insights and information on all these mental health issues, depression, anxiety, panic attacks, PTSD. So they draw from their clinical expertise and their research. So reading these books can help you deepen your understanding and provide practical strategies for coping and also healing. It's all about healing. So it's important to note that while these books can be helpful, they are not a substitute for professional help when dealing with mental health concerns. So remember, if you're experiencing depression, anxiety, like I used to, panic attacks, or PTSD, you need to consider seeking support from a qualified mental health professional who can provide personalized guidance and treatment. So I'm going to name you 3 therapeutic approaches I can suggest to your friend, to a relative, to someone that you care about who is suffering from depression and is too ashamed to go to a therapist. Okay, I understand, your friend, your relative, they may be feeling ashamed or hesitant about seeking therapy, but it's important to encourage them to prioritize their mental health. So it might be helpful to suggest some therapeutic approaches that can be less intimidating or help them ease into the process. So I'm going to share with you 3 approaches. The online therapy, so it's also known as teletherapy or telehealth. It allows you, your friend, your relative, someone who suffers from mental illnesses to receive therapy sessions through video calls or messaging platforms. So this option offers convenience, privacy, and also the ability to access therapy from the comfort of your own home. So there are numerous reputable online therapy platforms and apps that provide access to licensed therapists. One of them is BetterHelp. I suggest you Google it and find out a good therapist for yourself. Number 2, group therapy. And I went to group therapy. So group therapy involves you participating in therapy session with a small group of people, individuals who are experiencing similar challenges. So it provides you with a supportive and non-judgmental environment where you, the participant, can share your experiences. You can learn from other people's stories, their journey to healing, and also develop coping strategies altogether. So group therapy can be less intimidating for you, friend, and also they can find comfort and understanding in knowing that they are not alone in their struggle. Number 3, the self-help resources. So these are various self-help resources available in the form of books, workbooks, websites, and also mobile app. So these resources often provide evidence-based techniques and strategies for managing your depression, or your friends if they are suffering from anxiety, PTSD. So you could recommend some well-regarded resources such as Feeling Good, the new mood therapy that I just mentioned by David D. Burns, or some online resources like the Anxiety and Depression Association of America, ADAA, or the National Alliance on Mental Health, NAMI. So while all these approaches that I just gave you, they can be helpful, remember it's very important to emphasize that a professional and licensed therapist can provide the necessary guidance, expertise, and support to help your friend effectively address their depression. So of course, encourage your friend to seek therapy, emphasizing that therapy is a common and beneficial resource for many individuals out there, and that seeking help is a very courageous step towards healing and improved well-being. So the therapeutic methods and techniques to support and encourage people who are dealing with different mental health illnesses are great for them. What about someone who doesn't want to admit they need help? A loved one with NPD, narcissistic personality disorder. How can we help them? Well, that's a great question. Helping a loved one with narcissistic personality disorder, also known as NPD, it can be very challenging because these individuals with NPD often struggle to admit and acknowledge or seek help for the condition. However, there are still ways you can offer support and encourage them to seek professional help. So here are a few suggestions. Educate yourself, so learn about NPD to understand the disorder and its symptoms. So this knowledge will help you approach your loved ones with empathy and compassion. It's also important to recognize that individuals with NPD may have difficulty accepting criticism or admitting that they need help due to their fragile self-esteem. Yes, NPD, narcissistic personality disorder. It is a mental health. Number 2, set boundaries. So individuals that have NPD, they tend to have difficulties with empathy, and they may engage in behavior that impacts your well-being or crosses boundaries. Make sure to set healthy boundaries with these people. If you have a spouse, for example, if you're married with somebody who has NPD, or if you have a relative or co-workers, you have to be careful. You have to establish clear boundaries, and you have to communicate directly when their behavior is unacceptable, where they have crossed the line. So by setting limits, you can protect your own mental health, which is very important, it's priority, and also model healthy boundaries. Number 3, express your concern and empathy. So approach your loved one with empathy and express genuine concern. So use I statements to focus on your own feelings while describing the impact their behavior has on you. And of course, always avoid blaming them or attacking them. So don't use attacking language, as it may elicit a defensive reaction, especially with people that have narcissistic personality disorder. They always feel attacked, and they will definitely be on the defensive. So let them know you care about their well-being, and you have to suggest seeking professional help as best as you can as a way to explore healthier coping strategies. Is very important. Number 4, offer your support. So let them know that you are there to support them, you are there for them, and that seeking therapy or counseling can help address the underlying issues that contribute to their behavior. Suggest that therapy can improve their relationships and overall well-being, rather than framing it as a way of fixing them. So encourage them to seek help voluntarily, but of course remain mindful that you cannot force someone to seek therapy if they are not ready or they're not willing. Like my ex, he didn't want. He thought he was saying I was the one that was that I was the one needing therapy. So be very careful. Number 5, encourage self-reflection. So nudging your loved one to engage in self-reflection, that can help them gain awareness of their behavior and its impact on others. But there will be some people that will be reluctant, and they will resent you for that, and they will hate you, and they will continue saying no, nothing wrong with them, they don't have any issue whatsoever, they don't have a mental illness. If you stay with a husband or a wife that has this condition, it's going to be a living nightmare. It's going to drain you emotionally and mentally. So encourage them to consider how their actions align with their values, and how seeking therapy can help them lead a more fulfilling life by addressing underlying insecurities or emotional wounds. A lot of these people, unfortunately, when they were little, when they were a child, they experienced childhood trauma. They were physically abused, emotionally abused by their own parent. So either by two parents, both of them, mother and father, or by one of the parents, and it just left this trauma, and it's very, very painful to watch, to see, and there's nothing you can do. Some people, they will never change, they will never heal, unfortunately. But it's important to remember that you cannot change or fix someone that has NPD, narcissistic personality disorder. They will ultimately have to be willing to seek the help and actively participate in the therapy themselves. You cannot do it for them. So focus on taking care of yourself and setting healthy boundaries while you are offering support and encouragement. And if their behavior becomes abusive and dangerous, just consider seeking help from a mental health professional and reaching out to support group for guidance. And if it comes to physical abuse, get out. Mental, emotional, psychological abuse is really damaging and so detrimental to your brain. Some victims and survivors have said that they completely had a brain damage due to that. So just be very careful. So the main therapeutic approach to a better life. Let me recap. All these approaches can help and will contribute to your having a better life and overall well-being. And of course, the most effective approach will vary depending on your unique needs and your challenges. So I'm going to recap. Number 1, cognitive behavioral therapy. That one that I said earlier, is focusing on identifying and changing your negative thought patterns and behavior that are contributing to distresses, emotions, and problematic behavior. So this one will help you develop healthy ways of thinking, coping, and problem solving. Number 2, acceptance and commitment therapy. So this one emphasizing accepting difficult emotions and thoughts, and committing to action aligned with personal values. So they will help develop psychological flexibilities and resilience. It will improve your self-awareness and enhance your ability to live a meaningful and fulfilling life. Number 3, mindfulness-based therapy. So this one earlier I mentioned is very good, and it focuses on cultivating present moment awareness and non-judgmental acceptance. So these approaches can help you reduce stress, improve emotional regulation, and enhance your overall well-being. Number 4, psychodynamic therapy. Remember I mentioned unresolved conflicts. You explore unconscious patterns and early life experiences that may contribute to current difficulties. So this one aims to increase self-awareness, facilitate insight, and also promote healthier relationships and emotional growth. Number 5, the solution-focused brief therapy. So this is a goal-oriented approach that focuses on identifying your strengths and empowering you to find solutions to your problem. So it emphasizes small, achievable steps towards change and tends to be a more present, focused, and time-limited approach. And last but not least, 6, humanistic therapy. So this one is like a person-centered therapy. It emphasizes the client capacity for self-growth and self-actualization. So it focuses on building a supportive therapeutic relationship and providing a safe and non-judgmental space for you to explore your experiences and also for you to develop a greater understanding of yourself. So remember, my dear sister or my brother, if you're watching, oh yes, my channel is mainly for sisters, as I mentioned. For ladies, it's all about women empowerment, but men are completely welcome to come here to my channel and listen and learn. So it's important to keep in mind that these are just a few examples of therapeutic approaches, and there are many others available. The choice of therapy will depend on your specific needs, remember, your preferences, and also the expertise of the therapist that you will see. So it's always beneficial to incorporate other self-care practices, like I said earlier, regular exercising, a healthier diet, and maintaining social connections that are good for you, are also engaging in different hobbies and activities that you enjoy. That's it for tonight's episode, all about therapeutic approaches. Thank you so much for staying till the end, and remember that your mental health is priority. It's very, very important. It's your emotional, psychological, and social well-being. It encompasses various aspects of your life, including how you think, how you feel, and how you act, as well as your ability to handle stress, make decisions, and maintain relationships. So your mental health is your priority. It's very important because it will impact every area of your life. So thank you so much for watching. I'm your host. My name is Nyema, and tomorrow episode, if I am here, God willing, will be all about lifestyle and mental health. Lifestyle and mental health. Thank you so much for listening. Remember, stay learning, stay growing, stay thriving, keep going, stay positive, stay focused, be unbreakable.